And today, we're happy to have two RNs from Henry Ford Jackson Hospital. We have from the emergency department, Rachel Witgen and Anthony Jackson. Welcome to the show.
Thank you.
Thank you.
And Happy Nurses Week.
Thanks again.
Thanks so much.
Yeah,
Wonderful
both of
week
you,
to be
actually,
part
you
of.
work together in the ED, right?
Yes. Yes.
We do, yes.
What's your job?
Yeah, so I am the emergency department nurse manager. I've assumed this role for a couple years now. And from there, I was an emergency department nurse prior to that and went through nursing school at Jackson College, where I got my associate's degree and then went on for further education.
So you grew up here?
I did, yes. Yep, I went to Lumen Christi High School and have chose to stay in the area because I love it.
Fantastic.
Yeah.
Anthony, on the other hand, grew up somewhere else.
Yes. New to the area, from Akron, Ohio. I've been at Jackson just going on about 3 weeks right now.
3 weeks?
Yes, sir.
Awesome. How do you like it so far?
I like the area. Started checking out some of the local cuisine. Roxy's so far has been treating me great. I go there for breakfast every day. Yeah.
Well, Roxy's is a perfect spot for you because you're an athlete and a big guy. And
Yes.
Roxy's, they're all about volume.
Yes. Peanut butter French toast is my favorite meal there every
Sounds
day.
great.
Yeah.
Now, before the show, we couldn't help but notice how tall Anthony is. And how tall are you?
I'm 6'8".
And you were a professional and college basketball player.
Yes, played 10 years in Europe, France mostly, and then played in college at Cleveland State University.
Awesome.
Yeah.
And you had some pretty high caliber coaching.
Yes, Rolly Massimino was my college coach. Formerly, most people know him from Villanova when he won the championship in '85 against Georgetown.
Real class act.
Yes.
Now Akron, that's I guess now a hotbed of basketball talent. Who else is from Akron?
Of course, LeBron James. Yeah.
Did you ever know LeBron?
We know each other. Actually, we had the same personal trainer for many years, so he's just amazing as he looks on TV. He's amazing in person. A great dad, class act, hard worker.
Well, great. I think we all appreciate that you've left basketball to come to Jackson and take care of our community. So thanks. Nursing, it's some people call it a calling, and I think it is. You've got to be drawn to it. How long? I guess at what point in your life you decided to go into nursing, Rachel?
Yeah, I was always inspired by my mom. She was a nurse, an emergency department nurse for many years. Now she's a advanced practice provider, meaning a nurse practitioner. But so from a young age, I always saw like the work ethic, the empathetic nature, and just the compassion for caring for people, and that always kind of drove me to want to do the same.
When did you decide you wanted to be a nurse?
So actually, the last year I played basketball, I lost one of my sisters. Her name was Christina, to a blood clot, and that kind of inspired me to go into healthcare.
Interesting. You both had inspiration to get into it. Obviously, it's especially in the ED, high stress, but it can be really rewarding, I'm sure. What do you find most rewarding about being a nurse?
Absolutely. I think for me, it's the patients and then the staff. When I was at the bedside more, not the direct manager of the emergency department, it's always that reward of trying to be there for someone and their family on the worst day of their life, potentially, from birth to death to everything in between.
Yeah, I think that's got to be the most stressful part is as you have to deliver some bad news at times and be with the family when something horrible happens. But there are rewards.
Yes, I just enjoy the day-to-day interactions with everyone I work with, whether that be patients or staff members. I'm a people person, I like people, so I think sometimes I even forget that it's actually nursing. I just enjoy people, so just, again, the day-to-day interactions is what I enjoy.
And I think your patients, they feel that. I remember my visits to the ED, and you're with the nurse more than the doctor or anyone else, and you do get a relationship with your patients. Now, both of you have had quite a road to where you are today. You previously spent a lot of time hands-on as a clinician. Now you do a lot of management. How's your role changed since you first got into nursing, Rachel?
Yeah, so when I was first got into nursing, I actually went through our graduate nurse residency program right out of Jackson College, right into the ED. Loved it immediately, knew immediately that this is the department for me, just the high stress, high acuity, and it functions very heavily like a team. So I loved that aspect of it as well. And from then, I just really discovered a knack and really wanting to help mentor people to get where they want to be in nursing and help them achieve their goals and really make it the best place where if my loved ones show up at the door, I knew that they were getting the best care possible.
Do you feel like you're being a mentor? People are looking at you as a mentor and you don't even realize it?
I mean, potentially, I don't want to speak for them, but I definitely try to be boots on the ground and have some meaningful connections with the staff and patients.
And you're a manager in the ED. What's your role as manager?
Manager, so it's all the day-to-day functions of operations of the department. We help deal with a lot of issues that arise. We also work with budgets, staffing numbers, making sure that we're prepared for whatever comes through the door, and providing the education we need to the staff working.
And Anthony, also in management, you run in the department, Director of Emergency Services, Clinical Decision Unit, and Cardiac Monitoring.
Yes.
It sounds like a lot.
It is a lot, but I have great managers. I have a manager, Katie, over the CDU and CMS, and then I have Rachel, so just very collaborative. A lot of the same functions, but it just at a little bit of a higher level.
What was the first area that you were in clinically as a nurse?
The same emergency department.
Yeah.
All of my career, I've either worked in adult or pediatric level 1 trauma centers. I love peds. I worked at Rainbow Babies and Children's in Ohio under a UH umbrella. So again, always emergency department, either adult or pediatric.
People I know in that department, they say that's where the action is.
Mm-hmm.
Right?
Most definitely, yes.
People want that assignment.
Yes, yep. Typically you'll find at the heart of most ED nurses some drive for that high acuity, high stress, being able to answer the call.
When I've been there, I noticed it's like a team, and particularly in certain cases, I witnessed when someone came in with a stroke, and you've got like a stroke response team, and like 20 people are there. Teamwork is important in the ED. How does it affect the patient experience by delivering healthcare as a team?
Absolutely. It's very multi-collaborative within the ED, whether it's our attending physicians, Dr. Kim and his team, Dr. Sinkoff, the residents, and RT, it could be the trauma team, our nurses, our ancillary staff, including our patient care technicians and registration staff. It's a true team effort in making sure that we're all knowing our role and executing our role and communicating if we're needing assistance.
In building a team, you've got to look for certain traits in certain people, and everybody has a different part in their role as a team member.
So we're definitely looking for personality, hard workers, people who, again, like action, things of that nature. People that, obviously, me coming from a sports background, that is always something I'm looking for, is that people that are willing to play their role. That role can change at any time. So, you know, you said it earlier, it's just a team atmosphere, and you're very collaborative.
It's interesting because I think athletes have a unique exposure to a lot of people in healthcare. You've had team doctors, trainers, various other health professionals. So you could have gone in a lot of different directions, but you chose nursing.
Honestly, with nursing, I think originally when I was trying to find which area I wanted to go into, I originally started seeing a lot of accelerated nursing programs all over the area where I'm from in Northeast Ohio, and that just was a perfect fit. My sister went to Kent State when she was pursuing her degree in biology to eventually become a doctor. Kent State had a program that started every semester, including the summers, and so it just the timing was perfect.
So your sister that passed away, she was on her way to becoming a doctor?
Yes.
Oh, wow.
Yes. Yeah.
So I'm sure that it's honoring her. And,
Yes.
Yeah.
And it would have been a surprise for me at the time to know that I would be a nurse, you know, back at that time. But I love it. It fits, and I enjoy every day.
It's got to be really stressful, especially in ED. You see all kinds of things. How do you shake that off? How do you wind down and leave work behind when you go home? It's got to be hard.
Yeah, it definitely can be hard, and I think we all definitely have to take in our own mental health and physical wellness. For me, I make sure I get some fresh air, exercise, and definitely tune in and out to some of my favorite music to and from work. So that kind of helps get me.
Yeah, what do you do, Anthony?
So I'm actually a black belt in a couple different martial arts, and I do yoga. I lift weights. So yeah, judo and Brazilian jiu-jitsu, I'm a black belt in both of those. And then I've been doing yoga for about 12 years now.
Wow. So if someone should happen to become unruly in the ED,
We have a great security team for that. Our police officers and security officers are great for that.
so COVID was very stressing and changed how we do things. What would you say? Are there some silver linings to the pandemic and how your job is done and how people are taken care of?
I would say the use of technology for meetings, for care. I think that brought about, probably accelerated the use of technology in healthcare as one of the things. And then shoring up supply lines, supply chain issues. I think that actually helped a lot with finding different resources to get supplies that you need. I think that came to the forefront when this happened.
And people were actually afraid to come to the hospital in the early months of the pandemic because we didn't
Correct.
know.
Yes, yeah, a lot of unknowing, and just trying to make sure that our community, and they knew that we were there for them still, and we still had all of our nurses ready at the front line, ready to go, so they weren't backing down.
Well, I think one of the silver linings of the pandemic is that we became more aware and as a community more appreciative of our frontliners, our first responders and our healthcare workers. So I hope all the gratitude and honor that you all received during the pandemic, it continues and lasts. And that's for me too. So thanks for all you do.
Thank you.
Yeah, thank you.
And thanks for coming in today.
We appreciate you
it.
having
Thank
us.
We couldn't get every nurse on the show this week, so Rachel and Anthony representing all the nurses in our community, thanks for being here today.
All right, thanks again for having us.
You bet. From Henry Ford Jackson Hospital, nurses Rachel Witgen and Anthony Jackson.